I have with me today Amy Campbell, who is the former manager of clinical education programs at the Joslin Clinic, which is part of Harvard Medical School. It's their diabetes clinics, what they specialize in. So Amy, thanks for being with me today. Love to ask you a few questions about diabetes. So let's start with, what is diabetes for people who are newly diagnosed and don't know really what it is? So they're starting from ground zero.
Okay, thanks for having me. Diabetes is a condition that occurs when the body is not able to properly use and store glucose or sugar. When you have diabetes, glucose levels build up in the bloodstream, and that, of course, causes your blood glucose or blood sugar levels to rise too high. And if that's not treated and managed, over time, that can cause some damage to various parts of the body. Diabetes is actually a big problem in this country. It's estimated that about 29 million people in the United States have diabetes. By 2050, it's expected that 1 in 3 Americans will have diabetes.
Can you please explain the different types of diabetes?
There are 2 main types to be aware of, type 1 and type 2. So with type 1 diabetes, the body stops making insulin. Insulin's a hormone that is needed to lower blood glucose levels. So people with type 1 diabetes must take insulin by injection or by using an insulin pump in order to survive. Type 1 diabetes usually develops in children or in young adults, but it can occur at any age. And about 5% of people with diabetes have type 1. Now, type 2 diabetes is the more common type of diabetes. That occurs in about 95% of people who have diabetes. In this type of diabetes, the body usually still is making insulin, but the cells in the bodies aren't responding to insulin the way they should. And this is called insulin resistance. And sometimes, over time, the body stops making enough insulin. So in either case, blood sugar levels rise. Now, type 2 diabetes is more likely to occur in people who are over the age of 40, who are overweight, and who have a family history of diabetes. But unfortunately, more and more children, adolescents, and even younger adults are developing type 2 diabetes.
Do you want to talk a little bit about diabetes that is what they call latent onset, or LADA, or diabetes 1.5?
Sure. With LADA diabetes, it's really a slow-moving form of type 1 diabetes. And it can present itself almost as a case of type 2 diabetes. And it's not as common. I don't really have a statistic on that. It's certainly, of course, not as common as type 2 diabetes, but it can affect people who don't normally look like they might have type 2 diabetes. In other words, someone who's thinner, a little bit older, doesn't really have a family history, maybe following a healthy eating plan and exercising, but yet they still have these high blood sugar levels. And so researchers think that it's really just a very slow-acting or slow-moving form of type 1 diabetes, and eventually they most likely would need insulin to manage it.
How is diabetes different from prediabetes?
Prediabetes is a condition in which blood sugar levels are higher than normal, or higher than a blood sugar level in someone who doesn't have diabetes, but it's not high enough to be considered diabetes, so it's sort of this gray area or in-between area. It used to be called borderline diabetes, but that's not a correct term. So the right term is prediabetes. And essentially, it's a warning sign for people. Again, your body is either not making enough insulin, or the body is just not using its insulin properly. We talked about that earlier, and that's really the case of insulin resistance. What can happen is that slowly over time, blood sugar levels begin to creep up. And if it's not caught early on and treated early on, many people with prediabetes can go on to develop type 2 diabetes within about 10 years of diagnosis. The good news is that lifestyle interventions, getting on a healthy eating plan, losing some weight if you need to, becoming active, can greatly reduce the risk of you developing diabetes. And we know this from major clinical trials. It's kind of a warning sign, a call to action. If someone has prediabetes, it's time to do something to see if you can either prevent getting type 2 diabetes or delay it as long as possible.
Yeah, I've seen some research recently from some integrative practitioners who even think prediabetes is causing all sorts of systemic problems. Really like to see people in a much tighter range. And basically what they're saying is that if you have been diagnosed with prediabetes with a hemoglobin A1C or with a fasting blood sugar test, that your pancreas is already compromised and could be compromised more than the general understanding of Western medicine believes right now. So it's definitely a warning call. Yeah, I appreciate that. What else did you want to say about prediabetes?
I think for both conditions, prediabetes and diabetes, all it is really required is a simple blood test to find out where you stand. This is a test that you can get done at your doctor's office or at a lab, not at a health fair or at a drugstore, but in a standardized lab. And there are 3 tests that can be used to diagnose either prediabetes or diabetes. One is that you mentioned it earlier, the hemoglobin A1C, or A1C for short. You can also get a fasting blood sugar checked. That's where you come in usually in the morning after having not eaten anything for about 12 hours the night before. Or you can take something called an oral glucose tolerance test, where you have to drink a very sugary drink and then get your blood checked, for a few hours after that. Typically, either a fasting blood sugar or an A1C test is used to quickly find out if someone does have prediabetes or diabetes, and generally that test is repeated a second time just to confirm the results.
What the interval was of doing the fasting blood sugars to confirm from the first to the second?
Generally, it would probably be several weeks to about a month later.
Mm-hmm.
Just to, because there could be certain factors going on. So typically you wouldn't do it right away or the next day, but you might wait a little bit to confirm that. I think it's important for certain people who might be at higher risk for either prediabetes or diabetes to make sure they get checked regularly, again, with this blood test. And how do you know if you're at risk? Well, if you're age 45 years or older, you should get checked. If you have a parent or a brother or sister who has diabetes, get checked. If you're not active, if you've given birth to a baby, obviously if you're a woman, if you've had a baby that has weighed more than 9 pounds at birth, that puts you at higher risk. If you have high blood pressure, high cholesterol levels, heart disease, again, these are all risk factors for people, meaning that they should get checked. They're at a higher risk of getting diabetes. So it's important that at least once a year, maybe even more often, at your annual physical exam, for example, make sure your doctor is checking you for prediabetes or diabetes.